Hello, Barry. Well, here's a subject we can put together. You can put together. I'll start it off. And it's the subject of dental care for those with dementia. We could ask on the forum of people's experiences of dental care. And we've got a good dentist, and but he treats us on the National Health, but he's not sure how long he can keep working within the constraints of the National Health Service. He's been very good, and he hasn't done crowns on the National Health for a long time. And but when Linda's crown came off, he made an exception for her, and he's put one on. And in fact, when we all had a family check-up the other day, he suggested that she had the other one done while he could still do National Health dentistry. I'd be interested to know what dental care you receive out in Indonesia. And but so there we are. There's a subject for the forum: dental care for those with dementia. It's all to do. A person can be very nervous, and a person can be completely relaxed in their past, and they've coped with dentistry. But then the fears and the brain is not working, so it can be a whole fearful experience, and the dentist has to deal with that. Are there dentists who come to the homes of people with dementia? Not only dementia, of course, but other disabilities where the normal going to the surgery just is not a workable solution. So there's the subject matter, Barry, for the website, if you can do something with that. So looking up and looking out, Richard.
Hello, Richard. Well, you bring up a very important topic that affects all sufferers of dementias. As I know myself, that I do sometimes forget to clean my teeth first thing in the mornings, or even after a meal. In fact, so much so that I have now printed out a big sign that's on my bathroom wall that says, "Don't forget to clean your teeth." We do forget. Dental care is really very, very important. But it's strange, as I never used to be scared of going to the dentist. But now, the very thought of it makes me agitated. And maybe, like yourself, from what you said, it's better for us if we do it as a family checkup, as it could really prove to be less traumatic for us, almost like feeling not alone in the dentist's chair. Dementia care out here, you asked about. Well, it's not too bad, actually. And I can get to see the dentist any time I like without an appointment. But the only thing that does worry me is the fact that dentists here don't wear surgical gloves or a mouth mask. So I do worry a bit about cross-contaminations and such things. And you're only given plain water to rinse out your mouth once they've started work on your teeth. They don't put any antibactericide into the mouth rinse. So I normally have to do that myself when I get home with my own bacterial mouth cleaner. In fact, I had to have another tooth out just a few weeks ago. And again, this is really very strange, as I've never ever had any problems with my teeth before. Well, that is until I was diagnosed with dementia and problems with the teeth started. Anyway, we went off to the dentist, and my wife explained about my Alzheimer's and dementia to him first. and he was very understanding, as I think he could see just how agitated I was getting. And to be honest, I was getting very, very panicky and very reluctant to sit in the chair. But as I said, the dentist was very good and calmed me down. And Sumi, my wife, soothed my hands and was rubbing my arms as I had the injections. I really was very tense. I don't think anybody likes injections, if we're honest. I must admit, at the time, I felt as though I'd been in the dentist's surgery for hours and hours. But in fact, it was no more than 5 minutes, and the tooth was out. I think this is again where the dementia can take control of our actions, whereby something we never used to worry about can now have a momentary adverse effect on us. But as I'm always saying, we must be positive and remember that our personal care, and as well as our teeth, is very important within our illness. I think that when we're sitting in the surgery, a tip is to try and think of as many happy memories of life as you can, and not think of that particular moment of sitting in the chair. Well, that was my dentist's memory, Richard. And it's also reminded me I must go to the opticians next week for my eye checkup, which is something else that's very important. But that could be another recording. So anyway, Richard, that's it from me for today. I will be in touch with you again soon, and as always, my very, very best wishes to you all. Bye for now, Richard. Barry.